Poor her. Why poor her? My puns are fantastic.
I feel sorry for your producer.
How dare. So I appreciate everyone keeping it locked right here, all four of you, while you're in traffic, right? And you are driving wherever you gotta go. But my guests today have been awesome. The pet medic earlier on about CPR and first aid for your furry friends. Had no idea it existed. Now that I have added a furry friend to the household, I will be going for one of these courses. So find her at thepetmedic.pro or all social media channels at thepetmedic, because that's really where it's at. She also has a blog. It is fantastic. But currently,
oh my God,
again.
here we go.
I'm speaking with Bianca Ekmekcioglu from BeFit, the number 4 Health, which you have an Instagram.
And I have a website too if you need to go there.
Okay, well, digital is where it's at.
And electrotreatment.com.
Oh, nice.
No S at the end, just electrotreatment.com.
See, now everyone understands the current joke.
Oh, Lord.
I had to reiterate just in case. But if you've been following the program, we've been talking about this amazing technology that has AI-based impedance reading. It is so much jargon.
Biofeedback, NASA
yes.
missile technology.
Oh, the NASA missile, I forgot about that. But
Yeah.
honestly, it reads where your pain may live, it reads where the inflammation may live, it clears out your cellular base so that you can accept nutrients. You can accept all that water that they tell us to drink, since we're 70% water.
Yeah, I mean, and like I said, biochemically and electrically, we partner up well. I mean, our bodies are both. And so I will never ever say don't take anything that you need. But obviously, just to let future clients know when they come to me that you need to take your meds an hour before or hour after, because it will lessen the value of it, because I am pulling toxins out of your system. So, you need to understand that may be important, especially if you have a heart medication you're taking. So, things like that. But other than that, this device, like I said, it reads you, it scans you, it corrects you in milliseconds, and it lets me know, the technician, whether or not I'm on the right track of getting you to a place where you're working. And in fact, with my treatments, you don't just lay there. I actually have you get up and move around so that the brain connects with the body. And then
that's cool. I was going to ask you what a session looked like. So really, it's not just a typical
it's not like a massage treatment. No, I mean,
Okay.
Some clients have fallen asleep, and I have recorded them and blackmailed them later with their snoring, but that's a different story.
I know we're getting creeped.
No, but it's one of those things where if you're laying there, your brain's taking a vacation. So I need to have you move that body part so that the brain goes, oh, wait a minute, there is no inflammation, so therefore there should be no pain there. And if it still has a lingering ache, I'll take another tool that's called the Y probe, which is my favorite tool of the whole basket there, and I Y probe your back. It's like an electric massage. And it takes.
Okay, now I'm going to come back. You're next to Liliha Bakery, and we've got perks here. Okay.
It's great. I mean, it actually pulls the lactic acid out of the tissue so that you don't have that achy feeling. And it's so that if you drink that water you're talking about and flush out the toxins after you pull them out, you should be good to go. And like I said, depending on how severe you are or to how acute you are, I can't really give you a number. I can do a consultation with people, which I normally do. Like the first 30 minutes, I'll sit down with you. I'll get an idea of what's going on with you and how long it's been. And based on that, I'll give you a guesstimate. But sure, most of my patients are maybe 6 to 8 sessions, but the protocol that we normally have for people who have chronic issues is at least 12 sessions, because I need to reorganize your brain with your body. I have to get that reset and re-education set up so that the body does what it's supposed to do and the brain doesn't interfere with it.
Okay, so now I'm seeing everyone start calculating, right? So I told everyone to wait for this part of the conversation, so I cannot let them down. So I'm hearing that we wouldn't be spending as much on medications unless, obviously, it was absolutely necessary. But any of the pain medications, the inflammation, maybe you're possibly a candidate for surgery, or that's the only option they've given you. Look at all of the things that medically, the bills and all of the expense of any type of pain.
Right.
Any headache. I've seen specialist after specialist, and that's not cheap.
No,
right?
It's not. It's expensive. I probably spent $20,000-$30,000 just on going to the doctor to figure out what's wrong with me.
Oh, okay. So a session is $20,000 or $30,000.
No.
Oh my God! Everyone almost ran off the road. So, what can we expect from one session? Then obviously you can do a consultation to tell us our prescription, so to speak. And then does insurance cover this?
Insurance can cover it if you're a medical doctor, if you're working at a facility that does insurance work already. I personally don't, but I do accept FlexPay. I do give you codes that you can send off to your insurance company to get a reimbursement, so that I am flexible in that sense to help you out. When it comes to the price point, I mean, it depends on what's happening. So, I mean, let me ask you, with everything that we just talked about, what do you think the cost would be?
$20,000. No, I'm kidding. Honestly,
think of an expensive massage.
It sounds priceless, right? I mean, you're looking at this technology like I could actually feel better. I may not have to feel so down and sad and anxious, and everything just kind of gets lifted when you're not in pain.
Yeah.
I'd like to say it's probably around $500. Am I close?
No.
Really?
Yeah. I mean, you would think it would be charged that much because of the results
Up or down?
and because of the technology. It's much lower. Yeah.
Oh, so we're playing a game here. Okay, so I'm hot or cold. Okay, so go lower. $450. No, I'm kidding. How much would possibly?
Well, think of an expensive massage that actually works, because massage therapy feels great. You go there, you feel good. The next couple hours, you start feeling that ache again because it's inflamed again. It's not intentional, obviously, with massage therapists, right? But if you go to like a spa and you get a massage, what do they usually charge you?
About $200, $250.
Yeah. So, but it's not that. I don't charge that much either. So it's actually $175. I know it's usually $175 for one session. But I do require 3 because I need that chance to work with your brain. So most patients do well with 3, and if we have to do more, then we'll figure that out. But 3 sessions is $150 a session, which is nothing, and you get the results. I mean, for me, it's great. It'd be great if we had this in more doctors' offices, which is what I'm trying to do, is get doctors aware of this option for their patients that go in for pain. So orthopedic doctors, sports medicine doctors, perfect, right? Chiropractors, perfect, right? So it would be useful for them to be able to help their patients, not just help them with their physical therapy or giving them biochemistry, which they're pills, but it would be great to have the option of saying, let's try this, because this isn't a microcurrent, like you're bombarding them with current needlessly, mindlessly, like a TENS unit. No, this is an advanced technology that actually can go into your body, like as if we're looking through a microscope and seeing what's really going on inside and correcting it. And I'm not correcting it, the device is correcting it, but it's telling me it's done. And the only way I know it's worked too is when you stand up and you can put pressure on that knee that you couldn't before and walk out of my office without a cane. Hallelujah, we got it done.
Right?
Yeah.
Okay, so if the physicians out there are listening, right, and I'm sure we've got a couple out there who are like, wow, I do want to add this to my practice. Are you available to help with patient load? What does the certification look like? There's probably so many questions going through their brain. They're getting a headache and need you personally.
Well, if you're a patient that's going through this and you're frustrated because you're constantly going to the doctor and you're not getting the answers that you want, this might be a good suggestion you can make to your medical doctor and say, look, there's something out there that can actually help with pain that doesn't require medication. It's a microcurrent, picocurrent type of thing. That would be great. The doctors can actually. There are programs with the mother company that you were talking about that you can put a down payment and pay as you go, because it's not a cheap device, but it's not that expensive either. So you can have your ballpark range of what you think it could be. But it will help the doctor help their patients be more successful with the results. I mean, it's one of those things which is mindless.
So, okay, well, I want to go over again how to find you, because we have literally 1 minute and Leah doesn't let me link.
This was a big conversation that you and I could have spent 3 hours talking about all sorts of stuff, but
Elephant in the room, are you coming back?
I can, if you want me to come back. We can talk about things more specific. If your listeners have questions and they want to reach out to you and ask questions, I can always come back and answer those if I can. But go to befitforhealth.com, the number 4, not FOR, so befitforhealth.com, and go to Electric Treatment 101 on my Instagram, and you can go to my YouTube, which is Be Fit for Health. Okay?
Well, I appreciate you being here, and I appreciate the pet medic this morning. And honestly, I heard that the White House dog got kicked out. Maybe Joe Biden might be kicked out next week.
Maybe you need some current.
So keep it locked right here next Thursday when we say that's a wrap. Thank you so much for tuning in to Take 5 at 5. Aloha, everybody.